Okay, next person up is Alexis Danielle Roberts.
Can everybody see my screen okay? Perfect. All right, let's go ahead and get started. I just wanted to quickly acknowledge the other authors on our project as well. Down here at the bottom, Dr. Canfield, Dr. Griever-Rice, and Dr. Mishra. This is part of our team at the University of Missouri that we're working with. All right, so just a quick introduction. This is part of the presentation last summer as well, but there is an established relationship between oral health and systemic disease. So we have these kind of known associations between bacteria that can live in the oral cavity and systemic diseases like Alzheimer's disease, diabetes, colorectal cancer, cardiovascular disease, and specifically adverse pregnancy outcomes, which is kind of the focus of this project here. And why is this important? Well, because periodontal disease or gum disease affects just about 4 billion people worldwide. So this is something we should all care about. There are a couple different proposed mechanisms of how pathogens are passed. Obviously, the direct effect of endotoxins, but oral surgery and biofilm accumulation are probably the biggest ones that we're going to be focusing on, just in terms of appointments or procedures that would allow for passage of bacteria from mother to fetus. Okay, so oral pathogens can cause these adverse pregnancy outcomes like we've been discussing. They can cross the placental barrier directly, and the pathogens can also just cause kind of like a widespread systemic inflammation in the mother. And these are linked to outcomes such as preeclampsia, preterm labor, premature rupture of membranes, stillbirth, low birth weight, and neonatal infection. So there is kind of this, established association between rural status and accessibility to healthcare. I know Lauren's project kind of touched on that as well. This is connected to poor health outcomes overall, but there is kind of a paucity in the literature about the impact of race and rural status in specific geographic areas. So to our knowledge, this is the first analysis looking at markers of oral health and neonatal outcomes among pregnant women specifically enrolled in the Missouri Medicaid program. And the purpose of looking at the Medicaid program was to eliminate that element of, why is a patient not seeking healthcare? Is it because they don't have insurance, or is it, for whatever reason? So we're only looking at the Missouri Medicaid program. Okay, and our research questions, we have many, but essentially we just want to assess, does a person's race and their rural status impact number one, their access to healthcare, and number two, does it affect the severity of their actual oral health markers, such as periodontal disease? And then also, how does this impact neonatal outcomes? How does this impact baby and mom after delivery as well? Okay, so just to give some frame of reference here, this is a map of rural and urban counties in Missouri. So this is older population data from 2013, but I think it's pretty much the same still. So you can see here, we have 101 rural counties. This is the dark brown. And then in orange is our urban counties. This is 14 urban counties. Jasper actually is considered urban, which I was kind of shocked to find out. And there's different stratifications that you can find, about like rural, urban, meta-urban, things like that. But this kind of just gives you an idea of our patient population here in Missouri. All right, I also wanted to highlight here kind of our dental utilization, our availability in the state of Missouri. So you can see this is a 2019 map of dentists per county. In Jasper County, we're really fortunate to have, a large density of dental health practitioners, but you can see in the surrounding counties here, some of these have less than 5 practitioners per county. So I think it's going to be really important, especially as the College of Dental Medicine gets established, that we can start kind of training, physicians and providers that may be able to kind of go out into these areas and help our surrounding community a little bit. Also wanted to bring your attention to this map right here. This is just a zoomed in version of what's on the right here. But I went ahead and went to the Missouri Dental low cost care page and found all of the locations where a person can get Medicaid covered dental care. This is just for Southwest Missouri here. So obviously there's more throughout the state, but we are very fortunate, like I said here, in Jasper County, in Joplin, to have multiple clinics that patients can get care at. But, as you start getting more rural here, obviously we're lacking a little bit. So, all right. And then also just wanted to kind of show this to you. So this is data from Missouri PRAMS, which is the Pregnancy Risk Assessment and Monitoring System. And this is showing that since 2012, this data was between 2012 and 2017, this is the percentage of women that sought dental care during their pregnancy, went for a teeth cleaning basically. So that percentage has dropped about 5%. They had this kind of nadir here in 2016. They're not really sure why. This was actually mirrored nationally as well. Nobody really knows the reason, but for some reason it kind of went down significantly there. And then on the right here, also data from Missouri PRAMs. These are reasons why women gave for not visiting the dentist. So about 10% said that they couldn't find a dentist to take a pregnant patient. But this significant number here, almost 28% of women said they couldn't find a dentist who would accept Medicaid patients. So that's obviously going to be prohibitive to, finding adequate dental care, something important to consider. So for our study, we worked with Missouri Health Net. We obtained de-identified claims data about demographics of pregnant women in the Missouri Medicaid program. We assessed a study period of October 2015 to December 2019. Inclusion criteria were women between 15 and 49 years old enrolled in the Medicaid program during the study period. We excluded multiple gestations. And we're assessing individuals that have both pregnancy claims and dental claims. We're also assessing the severity of their oral disease by race and rural status, and that's going to be determined by county code. Here we have our dental claims severity scale. So this was developed by Dr. Sharon Gordon, who's one of our wonderful faculty at the College of Dental Medicine. She gave us, or kind of provided us with this 1 to 5 severity scale. So this is what we've linked to each individual dental diagnosis code. And so just to give you some examples here, 1 would be the least urgent, and that includes, just typical cleanings and, regular checkups, imaging, x-rays, things like that. And then over here, 4 and 5, these are more urgent appointments. This would be a root canal, removal of an impacted tooth, anything that requires IV sedation or deep anesthesia or post-surgical complications. Okay, and so for our results, we are kind of a bit at a standstill, unfortunately. So our team at the University of Missouri has been fantastic in kind of helping us with our statistical analysis, but they are working on a lot of projects. And so we're anticipating our data analysis to come back in early May. But for now, what we kind of have developed is that we are assessing 117 independent counties. We have 46,810 individuals in our study population, and we are assessing 6 maternal and neonatal outcomes. So you can see here, we're looking at maternal hypertension, diabetes in pregnancy, size, so small for gestational age, preterm births, large for gestational age, and post-term births. And we're also going to be assessing by race, which you can see here in these columns. So the next step, of course, we're waiting for our analysis. We'd like to build out a geographical heat map, similar to the one shown here, that can kind of show us the severity of oral disease per county among pregnant women who are in the Medicaid program. And then, of course, we're hoping to submit our manuscript at some point as well. So thank you so much for your time and attention. I just want to thank Dr. Dennis, Dr. Gordon, Dr. Talley, Dr. O'Connor, and our contacts at the University of Missouri for their assistance as well. If anybody has any questions, I'm happy to answer.